Hello everyone. Today we're going to talk about jaw surgery. We're going to talk about the biological perspective of the jaw surgery. A jaw surgery is a surgery based on the movement on the jaws. We can move three structures. We can move the upper jaw, the lower jaw, and the chin. Basically, we divide the patients in three classes. The class 1 is the patient that has like a straight line between the lower part of the nose and the chin. Then we have the patient class 2. It's the patient with a big underbite, a deep bite, and also in the profile view, the patient have a prominent upper jaw, but the problem most of the time is the lower jaw is very backward position. And then we have the class 3 patients. The class 3 patients are patients with a big, prominent lower jaw. We also have patients, not on the profile, but in the frontal view with a transverse problems. Those are asymmetric patients. So patients that have a deviation on the upper jaw to one side, those are another candidate from this kind of procedures. What symptoms or signs the patient could have? Like sleep apnea is a big symptom or is a big syndrome that includes snoring, tiredness, high blood pressure, high pulmonary blood pressure. We also have patients with facial pain related with function. Those patients that after eating have some pain in the head. Those are patients that had like issues with the bite. In patients with muscular pain, back pain, neck pain, patients with brain fog, tinnitus. About our protocol compared with the regular protocol, first of all, we do every single procedure minimally invasive. So we plan everything prior with a 3D software in order to know exactly where to cut, causing the less amount of trauma. Secondly, we use, because we need some plates made of titanium, we place the plates in some strategic areas in order to remove it with local anesthesia here in a dental chair, around 6 months after the surgery. We try to regulate the patient first with our functional protocols in order to increase the healing process and to reduce the oxidation in the tissues. We use hyperbaric chamber in 100% of our patients. Thinking as a biological dentist, one of the main pathologies that we can treat with the jaw surgery is the sleep apnea. We know that the main factors for recovery in general is the sleep. If you cannot sleep well during at least 8 hours in a row with very good deep sleep, of course you're always gonna wake up very tired, and at the end you won't be able to recover yourself. It's where the body recovers for everything. So the sleep apnea is a problem related with periods of apnea. There are periods of time in which the patient cannot breathe. It wakes up the patient in order to try to breathe. Those patients when the problem is a peripheral related with the structure of the jaws, with a jaw surgery we can fix the problem, because if the neck space is reduced, we'll be able to move the jaw forward in order to open the space. So when the patient is asleep, that space it's not completely collapsed. So part of the problems that we can find in patients with sleep apnea are metabolic issues, mental illness, cardiac problems, pulmonary problems, obesity. And based on Stanford University, that is where the sleep apnea is very well studied. The maxillary advance is the #1 treatment, thinking in long-term treatment to solve the peripheral sleep apnea. If you're presenting one of those symptoms and if you have questions, we will be more than happy to help you.